Hello, welcome to today's presentation, Colon Cancer Awareness, presented by Dr. Jasmine Huynh, oncologist with the UCSF Washington Cancer Center. Dr. Huynh earned her medical degree from Tulane University before completing her residency and fellowship at the University of California, Davis, where she served as chief fellow. As an oncologist, Dr. Huynh specializes in the diagnosis and treatment of cancer, with a specific focus on cancers of the digestive system. She is deeply committed to research and is currently involved in several clinical trials. Her goal is to discover treatment options that are not only more effective, but also come with fewer side effects than current therapies. Please welcome Dr. Huynh.
Today we'll be talking about colon cancer awareness, including risk factors, screening strategies, treatment, and prevention. One of the first things to go over is the purpose and the anatomy of the colon and the rectum. The colon, also known as the large intestine, is the part of the body that helps to absorb water and electrolytes from the food that we eat and helps to produce waste. We often use the term colorectal cancer because the rectum is the last 6 to 8 inches of the colon, and this is where stool is stored before having a bowel movement. So, how common is colon cancer? Colorectal cancer is the third most common cancer in the United States. It is the fourth most common cancer overall in both men and women. 1 in 24 men and 1 in 26 women has a lifetime risk of developing colon cancer. Something to note is that young onset colorectal cancer cases have also been rising at a rate of 2 to 3% per year, and these are cases diagnosed in individuals who are under age 50. Some common risk factors for colon cancer include age. Typically, we think of this disease in patients who are over age 50, but as mentioned before, we are now seeing more cases in younger adults. You are also at risk for developing colorectal cancer if you have a family history of colorectal cancer, specifically if you have a family member who is diagnosed under age 50, or if there's a family history of having many adenomas or precancerous lesions. There can also be genetic syndromes, such as Lynch syndrome, that put patients at higher risk for developing colon cancer. Something important to note is that lifestyle, including a diet heavy in red or processed meats, put you at higher risk of developing colon cancer. Not eating a lot of fiber in your diet is also a risk factor. Being obese or having a very sedentary lifestyle also puts you at risk. As expected, you may also develop colon cancer if you have heavy tobacco use or a lot of alcohol use as well. For patients who have chronic diseases such as inflammatory bowel disease or cystic fibrosis are also at risk of developing colon cancer. So there are several ways to screen and diagnose colon cancer. Colonoscopy still remains the gold standard for screening because it allows for a direct look or visualization of the colon. It also has the benefit in that it allows the gastroenterologist or GI doctor to remove any precancerous polyps that may be found. Other options for screening include a stool-based test where you are sent home with a stool collection kit. There are different types of stool-based testing, but the most common are FIT testing, which needs to be done yearly, or Cologuard testing, which is done every 3 years. More recently, there is the option for CT colonography, which is using a CT scan to screen for colon cancer. One thing to note, though, is you still need to drink the colonoscopy prep for this procedure, and it does come with a risk of radiation. And newest to the scene is that now we can screen for colon cancer using blood-based testing. There's currently an FDA-approved test called Shield testing, and this uses cell-free DNA technology to screen for colon cancer. One important thing to remember about stool testing or CT colonography or blood-based screening is that if an abnormality is found on one of these tests, you will still need to get a colonoscopy for the GI doctor to be able to directly visualize the colon and see if there is any concerning mass or lesion that could be cancerous. So if you or someone you know is diagnosed with colon cancer, there are many treatment options. Typically, for patients with early stage or localized disease, meaning that their cancer is only in the colon, treatment will typically consist of surgery, and certain patients will need chemotherapy after. For rectal cancers, we often use a combination of radiation and chemotherapy prior to doing surgery, and some patients with rectal cancer can even avoid a surgery. If a patient has stage 4 disease or metastatic cancer, that means that the cancer has spread from the colon or rectum to another area of the body. For these patients, we often use immunotherapy for some patients if they have certain molecular features of their cancer or other targeted treatments. One thing to note is that there can be good prognosis for patients with stage 1 through 3 disease, and even some patients with stage 4 disease can become disease-free or essentially cured after treatment. So, what can we do to prevent colon cancer? There are several strategies that we can take and lifestyle changes that we can make to help with this. The first is make sure that you get regular screening for colon cancer starting at age 45. Again, colonoscopy remains the gold standard, but there are still stool-based, imaging, or blood-based tests that we can do. But remember that if one of those shows an abnormality, a colonoscopy will still be recommended. It is important to maintain a healthy weight and active lifestyle. It's important to have a high fiber diet that is low in processed and red meats. You should also try to limit alcohol use and avoid tobacco. It's also important to know your family and personal history and obtain early colon cancer screenings if recommended by your doctor. Lastly, it's important to be aware of your body and watch out for any warning symptoms. These can be things like weight loss without meaning to, called unintentional weight loss, noticing blood in your stool or dark or black stools, having chronic constipation, as well as having abdominal pain or night sweats. So with regular implementation of all these things, these can all help to prevent development of colorectal cancer. All right, so that is all that I have for today. I'm happy to take any questions.
Thank you, Dr. Huynh. Our first question is a stool-based test like Cologuard enough to screen for colon cancer, or is a colonoscopy still needed?
Yeah, this is a very good question and something that we get asked often. Unfortunately, even if you proceed with a stool-based test like FIT testing or Cologuard testing, if there's some abnormality on that test, so for example, if it comes back positive, we will still recommend doing a colonoscopy because that will allow the gastroenterologist or GI doctor to take a look directly and see if there's a mass or some lesion that's bleeding inside the colon.
Our second question is, I have difficulty drinking large amounts of liquid for my colonoscopy prep. Are there any options that may make it easier for me to prepare for the procedure?
Yeah, this is also something that many patients have hesitation about, and one of the biggest barriers to patients proceeding with colonoscopy screening. So as of now, there are actually several different types of prep that are lower in volume, meaning that there's less liquid that you would have to drink. And there can even be a tablet form of the prep. So these are all options that you should ask the gastroenterologist about when you meet with them for a consultation for the colonoscopy.
Our final question is, are there any genetic tests that can assess my risk of colon cancer?
Yeah, unfortunately at this time, unless there is a heavy family history of colon cancer or many family members have the colon cancer, there's not a standard genetic test that we can do to assess for colon cancer.
This concludes our program. Thank you, Dr. Huynh, for this insightful presentation. And thank you, viewers, for tuning in. The entire broadcast of today's presentation will be available on YouTube.